Hey, my name's Kayla. I'm a respiratory therapist and I created Cozy Cloud Respiration. It's a hub that helps to connect CPAP and BiPAP users worldwide. It's going to help get you that support that you need at home when your DME company isn't available, or maybe, honestly, maybe they're just not responsive. I want to talk to you today about mouth tape. Mouth tape is appropriate for some people. Other people, it's not appropriate. Okay? If you have been diagnosed with obstructive sleep apnea, this is what a normal airway looks like, okay? So you have this soft palate right here, and you also have the back of your tongue. When you have an obstruction or you've been diagnosed with sleep apnea, what happens is the back of the tongue or the soft palate will actually close off. So as you can see, there's no pathway for air, right? If there's no pathway for air, we're not oxygenating our tissues and we're not supporting our organs. When that closure occurs, it is going to pull you out of whatever level of sleep that you're in. The purpose of CPAP is to make sure that we're stenting open that airway so that your level of sleep is not disturbed, all right? Mouth tape is going to be appropriate for people who are using the nasal mask, but maybe find themselves to be an open mouth breather. If that's the case, and you have been diagnosed with sleep apnea, you could always try, if you want a smaller apparatus, something a little less bulky, you could always try mouth tape. You can, if you want to, order it off the TikTok shop. You can do, you can order it on Amazon. Really, there's lots of different places. I do find that some mouth tape is excessively priced, and I would never pay that much. So let's help to determine whether you're even appropriate for that, right? If you're an open mouth breather and you want to transition and try a nasal mask, we are all obligatory nasal breathers. The reason why our jaws open while we're sleeping is that's our brain's innate way of dealing with this obstruction, right? So in theory, if I can support you through your nose, this closure should not occur. We should have that air pathway open. So what you can do is you could go down to your local pharmacy and you could literally get some tape. This is a great way to check it out to see if it would even really honestly be worth it for you to invest in mouth tape. I'm using this kind of tape. I would not suggest that you use this tape. Get like the clear tape, the medical tape, something along those lines. But just kind of giving you the idea so that you can see this. What I would recommend is taking 3 pieces of tape and just kind of running them together like this, right? So this is about the width of my mouth. What you can do then is take this tape and just kind of stick it on the back of your hand. Kind of reduces that tackiness. We certainly don't want to cause like any breakdown with your skin, right? So once you have that, kind of reduce that tackiness, take that tape. And go to sleep. See if it works. If you find that you're not having a bunch of puffiness in your cheeks and you're successful with that nasal mask, then mouth tape would be an appropriate choice for you. However, evidence has shown that if you have been diagnosed with that obstructive sleep apnea, using mouth tape and not using your CPAP is not a great choice. Why? Because what you are doing is you are really, really increasing that workload. If we are closing, if that airway is closing because that pressure isn't stenting that soft palate and that tongue forward, then that closure is still going to occur, right? So let's say that then you pop that tape on your mouth, your body still has that closure. So what happens is you really, really increase that work of breathing. When you increase that work of breathing, it's going to wake you up more often, and it's going to be even harder for your heart to function, and it's going to really make it impossible or make it really difficult for your body to get into any REM state of sleep. So overall, mouth tape can absolutely be beneficial in appropriate cases. Other cases, not so much. If you have questions, I would highly suggest that you reach out to your provider, or we can chat and see if maybe it would be an ideal option for you, or if I would suggest otherwise. Have any questions? Let me know. Are there any topics that you want to discuss about your CPAP? Also let me know. I would love to discuss it. Check out my website, cozycloudrespiration.com.